Thank you so much, Ms. Mariam Asifi. Our next speaker is Dr. Francisco Martinez Peñalver, a distinguished age management doctor and medical director at Tiara Health. Sorry.
Perdón, para pasar diapositiva. Hi, good morning, marhaba. Eu escutei também em português. Bem-vindos a Marbella. My name is Francisco Martinez. I'm the Chief Medical Officer of Tiara Health. We are a company dedicated to age management medicine to prevent all the aging and to assure longevity, as much health as we can assure. We are based on medical evidence. This is one of our strongest pillars. And I would love to have a brief talk about several points of this anti-aging. Okay, let's try. Sorry for that. Okay, sorry. So the first point would be to clarify one very important aspect. We speak about age management medicine because when we speak about anti-aging, it seems that we are speaking about only aesthetic medicine. Age management medicine is a wide concept, meaning from the inside and from the outside. The age management medicine would be a proactive and preventive approach to help focus on optimizing aging, with the goal of enhance the quality of life, prevent age-related disease, and promote longevity. This is a concept that we have read many times on many places, but there is a word which is a little bit on top of this. Age management medicine has to be individualized, meaning that every person is aging on a different way, and in the same person, the aging is different according to the stage of the life. So the challenge, and also my passion for this medicine, is because it's different in every patient. Every patient is a challenge. So what we do in the medical centers dedicated to age management medicine is to explain patients what is the difference between biological or chronological aging. I'm sure that if you go to a meeting with your schoolmates, you will see that some of them looks the same as they when they were 20 years old, and other looks like 20 years older. So this is the difference between the biological and chronological aging. And we measure in Tiara all the biological aspects of our patients, so we can measure the age of the brain, of the muscles, of the bones, every organ, we can measure the age. And then with our dear friend, the AI, which is present in our practice every day, we will tell the patient, we will give the patients an information about what is their exact biological age. Of course, sometimes the comparison with the chronological age will be beneficial for the patient, sometimes will not, and has to be a stimulus to put things in place and improve the aspects that are related with aging. We all know about genetics. It's one of the most important factors of aging, but we face in Tiara genetics in a very particular way. You come to my office and say, "Hi, doctor, I want to do a genoma." Okay, you can do a genoma. We do the genome of our patients with Cambridge University. Wow, it's Cambridge University, it's a complete genoma. But genoma cannot be changed. The information of our genes cannot be changed yet. What we measure in Tiara is the epigenoma. The epigenoma, you have to imagine that the genoma would be the library of your house, and the epigenoma would be what books I like to read from this library. So according to our lifestyle, according to our nutrition, according to our hormones, according to the environment, the pollution, everything, we will express some genes or not. So for the same aspect of the life, we can express the bad genes or the good genes. So we inform our patients, if you are doing this, in the next 10 years, you will develop a diabetes. But if you change this, probably you will never develop a diabetes. We give patients information, and I think that the 21st century medicine has to be like that. We need to provide information to our patients, and on aging, this information is essential. And then, a very important topic. We are very good, doctors worldwide, we are very good on intervention. So in 1986, if you had a heart attack, your chance to survive the next 5 years was between 5 and 10%, 1986. Now, we have reversed this statistic. If you have a heart attack, your chance to survive is between 90 and 95%. So the gap to improve through the intervention is really small, but we have the prevention. I have 2 daughters, so I have TikTok, I'm sorry. And on TikTok, I read that a really, really nice slide that I couldn't bring it. The heart attack at 60s starts at 30. The Alzheimer's disease at 70 starts at 40. And the loss of movement and the dependency at 80 starts at 40. So we have to enforce the prevention. We have a huge gap to improve the life of our patients with the prevention. So the pillars of age management medicine would be the same as the keystones of aging: nutrition, hormonal optimization, cellular regeneration, exercise and metabolic health, sleep and stress management, and our extra, which is the preventive medicine, okay? So nutrition, we know a lot about nutrition, but this knowledge has been compiled in the last 10 years. So we will know more in the next 5-10 years. We know that if we spread the surface of the guts of our patients, the area would be a tennis court. It's huge, and it's inside. And the distance between the stools and the blood is only 1 cell. So it's a huge surface, but a minimum distance between the good and the bad things. So stress, antibiotics, pollution, environment can make really holes in this surface, in this layer, and will pass through this barrier, things that shouldn't be passing. Our body will respond with chronic inflammation. And you see in the office a lot of patients telling, doctor, I cannot eat anything. Anything I'm eating, I'm bloating. Even if I'm drinking water, I'm bloating. Okay, there's a leaky gut. There's a fail on this barrier. And how is this connected with aging? Any chronic inflammation, and this is a chronic inflammation, will affect how people is aging. We work in Tiara with the nutritionists, the doctors. We work together looking which is the best anti-inflammatory diet. But again, let's back to the first word, individualization. Everything in Tiara has to be tailor-made because aging is different in every patient. And according to our tests, according to what we measure, what we find, we will decide which is the individual treatment for every patient. And the hormones. This is really maybe my favorite slide. Men and women, we are aging with the hormonal decline absolutely different. And these differences will make struggle situations in our daily lives. Men, the decline is progressive, very slow. 1-2% less production of testosterone from the 35 years old, meaning now you can make your calculation, okay, I'm 55, ooh, maybe it's too much. Yeah, and testosterone for men means food for the brain, food for the muscles, of course libido, of course joy of life, okay? So we're losing really, really progressive, slowly, and sometimes we don't notice it until we need it. And of course, the health and the quality of life will be affected for your levels of testosterone. Otherwise, the aging, but the stress and the nutrition and the sedentarism can make this decline faster. That's for the men. But the women, half of the population of the world, they have a really slow decline from the 35 years old, stopping the production of testosterone and progesterone, the two hormones that make women to be chilled, to deal with stress, to have a good life. So after the 35 years old, this sensation starts to decline. But then they reach the cliff of the menopause. And until now, in Europe, not in the States has this very clear. Every woman is doing HRT, hormonal replacement therapy, but not in Europe. You go to, oh, hello, hola, ¿me has cambiado la presentación? Okay, anyway, I can do it. In Europe, you go to your doctor, doctor, my hair is falling down, my muscle is not working, I'm gaining weight, and I don't want to see my husband anymore. I don't want to see my kids anymore. I cannot work in this situation. What could I do? And doctors in Europe will tell you, oh, that's nature. This is what nature is waiting for you. No, but I have to live 40, 45 years else, but I cannot live with this. Oh, it's nature. Oh, so maybe I have to go to the States to be treated because the North American Menopause Society says that all women has to be treated. And you can say, no, but my sister, unfortunately, she had a breast cancer, she cannot take hormones. No, no, no. NMS, North American Menopause Society will tell you how, but this is something that in Europe is not existent, but in the States, every woman has to do it. And if you're in the States and your doctor is not prescribing hormones, they can sue the doctor. So these are, sorry, it's a brief talk. The difference between men and women, we can be, I don't know if Mr. Gassan give me the Wednesday, we can speak about this, all Wednesday, okay? So we measure in our patients, after a very complete medical history, we measure the levels, but we treat patients. We don't treat numbers. Sometimes the numbers that we need to reach will be this, but the situation of the patient change the things. So, again, personalization. Cellular regeneration. This is a slide that I was thinking to put or not, because in Spain, there is a really, really legal constraint about cellular regeneration. IV drips in the clinic, we cannot do it properly. It's really, really pushed by the administration not to do it. And also because NMN, resveratrol, rapamycin, our authorities, they don't think that they are really useful. But we have other things that we can do, ozone therapy, legal. We can do hyperbaric chamber. In Tiara, we do have the hyperbaric chamber. And it's only 30 seconds to explain how the high-pressure oxygen goes to the plasma. And this means that we will reach with pure oxygen parts of your body that long time ago they got exhausted without oxygen. So we have the constraint of the legal for the cellular regeneration. But if you ask me, doctor, some people, what is the best pill for aging? What is the pill that you have to take to not age anymore? Exercise. Oh, come on, doctor, that's not a pill. Yeah, but it's the action with more evidence through the aging. So I have a friend that he likes to exercise, but the rest of the people, they don't like exercise. But it's something that we need to include in our program, our daily program, because it really changes the life. You have to think in the muscle, not of something that moves your arm or your legs. I don't know if you have in your house this vacuum, the Roomba, that goes through the house, and goes cleaning, and you don't notice that it's cleaning, but it's doing. This is what muscle does. The muscle is an endocrine organ that cleans off many dust, of many garbage your body. So it's necessary to understand that we need to feed the muscle. How? Exercise. How? Hormones, yeah. How? Nutrition. We need to take care of the muscle. And again, personalization. After 40 years old, cardio is not the best option. Strength is the best option. I still have patients that say, no, I'm doing twice a week sport. What sport? I walk. Sorry. Of course, it's better than staying the coach, but it's not your exercise. What we do in Tiara is make a tailor-made program of exercise. according to measuring the potential of your muscles, according to measure how's your life, for sure. So again, tailor-made, individualization. Sleep and stress management, it is the same. If you don't sleep, you will get sick. The sectors with night shifts has 30% increase the risk of cancer. Why? Because during the night, our neurons, our body is cleaning. So you can say, okay, I'm not going to sleep tonight. Tomorrow I will sleep 12 hours. That doesn't work. What you don't clean tonight, you will not be cleaning next night. It will stay there and will be part of a future disease. We measure, we have, and I have to say, we have one of the 3 top sleeping researchers in Granada. It's close to here. His name is Darío Acuña. We do a tailor-made study of melatonin. We see how was your melatonin profile when you were born, and we compare with your real, and we fill the gap again. Personalization, again, tailor-made. So what we do in Tiara is our extra value. It is the preventive medicine. We try to be forward things. So we do aesthetic for sure, because aging is also the outside, but we do age management medicine, which means preventive medicine, hormone replacement therapy, IV drips. Yes, we do. When the patient needs and approved by the authorities, it is a constraint. Yes, it is a constraint, but we try to do it in a legal way. Nutrition, of course, our nutrition is, there's nothing, I think, more tailor-made than the nutrition, because everyone has a different taste. So we need to also modulate that. The physical exercise, our relax area, our supplementation. Also, we have a concierge of supplementation. If you sit down tonight at dinner, please make the experiment. Ask all the people around you, are you taking any supplement? Everyone is taking anything. Magnesium, okay. What kind of magnesium? Citrate, okay, citrate, but why not buy bisglycinate? Oof, my brother-in-law takes the citrate and it works. But you're not your brother-in-law. So we do a concierge of supplementation, and I think this is another really useful thing. So, 2, 3 more slides. AI, it is very important. We have, in Marbella, we have the best hospitals, we have the best medicine, we have the best everything. But it is very important how to read the things. Because the range of the blood test, I'm in the range, doctor. Every parameter is okay. The range is for, imagine, free testosterone. The range is for a guy of 18 years old and for an old man of 95 years old. Where do you want to be? Close to the 18 or close to the 95? Because you are close to the 95, it's in the range, okay. But it's not on the, should be, on the place that it should be. So we measure everything, we match with the AI, we give a picture, a really, really accurate photo of their health, and we continuous health monitoring. Now, we have smartwatches, we have smart rings, we have smart everything, and these can be applied to following by your doctors. How? We have a lot of data for our patients, and we combine the data with the AI. So if we do that, if we do all the stuff, what will we achieve? You will achieve very, very healthy aging. We will enhance the physical and cognitive function. We live in the best place of the world, in my opinion. I like to play golf, and I like to be 95 years old and trying to achieve my handicap. I want to do that. I want to have 95 years old and look at my wife and say, wow, I want to do that. So we will reduce the chronic disease risk. We will reduce, and this is absolutely proven, the risk of neurocognitive disorders. We will reduce the cardiovascular disease. We will reduce the cancer. How? Of course, if you have a healthy habit and you have an early detection, the risk of something's happening is much less. And we will improve, for sure, skin health, vitality, and overall wellness. I have 2 daughters. I want to play with them. I want to see them growing. And I'm trying to reach my best version, and I try my patients to reach their best version. So, sorry for the quality of the pictures. We have the premier age management clinic in Marbella. We try to provide longevity solutions for optimal health. We are the state-of-the-art of diagnostic and therapies. And we have real-life examples. I have a couple. She's 74, and he's 77. And they celebrate last week St. Valentine's like the first time. They are happy. They have the cognition system is perfect. The muscular, they are improving a lot because they are exercising. And the cherry in the cake is that meanwhile this project is advancing, we are collecting all the data, and we're going to produce evidence on age management clinic, which will be the next step. So your longevity journey starts today. You can visit us tomorrow afternoon after the Congress. You are more than welcome. And any question, I'm here for you. Nadia, un micrófono para ella.
Hello, my name is Nada Aladdin, and I am from Lebanon, and we have the same concept in Lebanon as you do here. So my question is, you do IV drips, and what kind of IV drips you're doing? And I want to ask you if you measure the biological age before and after the treatments.
Sorry?
I want to ask you if you measure the biological age before and after the treatment.
Of course. Before and after, once you start the treatments, you're not ending. We are creating a story with our patients that they have to follow this for all the time. And of course, the biological age from the first time they come to the clinic, after the first visit, we see how this decrease. We see how with the CNS, which is a test of Harvard University for the cognitive status, we see an average of 6-7 years less after the first visit. And regarding to IV drips, and we have here one of the biggest company of Marbella of IV drip, we have a legal constraint here because you cannot order an IV drip and have the IV drip waiting for that in the clinic. The patient has to make the compounding with the pharmacy many times, and the inspectors and the authorities are really, really on the clinics because they don't want to do IV drips. But of course, if I want to put iron, if I want to put vitamin C, if I want to put vitamin B, there's no problem with that, but we're very constrained with that. We have formulas that we individualize to any patient with all the things they need, but some of the things, the patient has to make the order to the pharmacy, and we lost a lot of patients with this system, but it's the authorities struggling this.
So just I would like to tell you that there is this hypomethylation and hypermethylation test that you can do to measure the biological age. And when the patient comes, you do the hypermethylation test for them. So you know if they are 50 years old, they will be like 45, or usually it's always more. So if because of the stress and because of all what we are living, usually if you are 50 years old, you will be like 55 or 60. And when you do, there is a lot of studies now in California and in for alpha-ketoglutarate, calcium alpha-ketoglutarate, Rejuva. There is a lot of studies on resveratrol, and all these have been proven scientifically that they decrease your age 8 years. So your biological age, if they come to your clinic and you do IV drip for resveratrol, and I do not think that this is forbidden in Europe because the resveratrol you can buy it.
There's no.
Yeah, so you can do IV drip for resveratrol, and it's been proven that it will decrease your biological age. You can do calcium alpha-ketoglutarate, and it's been proven in California on people, that they do research on people, that you will be 8 years less in your age. Like if you are 50, you come to the clinic, you do calcium alpha-ketoglutarate IV, you will be like 42 years old. And this is what we are doing. And now all the science is going this way. So,
Unfortunately, for our authorities, we need evidence A. The studies you mentioned is only B and C, so we didn't reach that point. Of course, we use calcium because it is approved, and the aspect you mentioned with the methylation is one of the 48 parts of our epigenetic test.
Exactly.
One, methylation, phosphor, mitotic index, dunitine pace. We have this in our epigenetic test, which is amazing. It's done by the University of Singapore. So thank you for your question.
thank you very much.
Thank you very much. Oh, one more.
Hello. Thank you very much for the excellent presentation. My name is Dr. Mohammed from Kingdom of Bahrain. Thank you very much. I just want to ask you about the aging. Well known that Mediterranean diet is one of the best, and we can see the age in Mediterranean Sea is high. But at the same time, we see in Japan, the age also is quite, but they have a totally different diet. So do we need to focus more on its genetics or on diet?
There is a nice, thank you for the question. There's a nice program in Netflix talking about this, the blue zones. There are blue zones around the world with absolutely different types of diet, with the increased longevity compared to other parts of the world. Mediterranean diet, again, for some type of people, because we need to individualize, it is beneficial on the inflammation, chronic inflammation of the guts. Japanese, it's a very low-calorie diet, and honestly based in rice and fish, so they don't try the red meat, and I'm sure that helps in any sense, but we don't know how the Mediterranean diet is affecting. We don't know how the Japanese diet is affecting. We need to assess every patient and recommend, for sure, if you see all the Mediterranean area, these areas that are keeping the Mediterranean diet because we are losing the Mediterranean diet, if you see the longevity, it's much more increased.
Thank you very much.
Thank you very much.
Good morning. I'm Mame Martinez. I'm facilitator. I would like to know, do you use the seawater for any treatment?
The seawater?
Yeah. Or do you have any study about that? Have you thinking about that? Or?
I was the medical director of a Talasso for a while, so I know about the benefits. And as supplement, we can use it. And I recommend sometimes. My nutritionist is a crazy man for the seawater, and depending on what type of seawater. But I really like it and use it, but there is no evidence on that. The French has, again, same as said to her, the evidence is BC, meaning some experts, some, but not really papers with really evidence and on that. But I like very much, and it's a very nice solution for the leaky gut, for the intestine. Thank you very much.